Welcome to the audio lecture for chapter 11 through 13. In chapter 11, we're going to talk a little bit about the overview of health services delivery systems. And we want to begin the discussion on this audio lecture by talking about questions that you should be asking yourself when you're working in the healthcare industry and you're wanting to know how things are how the operations run. One of the things that you want to, or one of the very first questions you want to ask yourself is, who delivers the care? Is it the physician? Is it the nurse? Is it the lab technician? The physical therapist, the respiratory therapist, the x-ray technician, who's actually delivering care to patients. And of course, that care is dependent upon what the patient is in the doctor's office for, or what the patient's in the hospital for. Next question is, what kind of care is delivered? Again, that depends on the patient themselves and as far as what their healthcare needs are. Where is care delivered? Okay, so we already know that can be things such as hospitals, doctor's offices, rehab centers, nursing facilities, assisted living facilities. When is care delivered? Care is delivered based on the needs of the patient. If it's emergency or hospital, you know that's 24/7, 7 days a week. They don't shut down. If it's a doctor's office, it can be anywhere between 8 and 4:30, 9 to 5, 5:30. How is care delivered? That depends on, again, the needs of the patient. Because it could be that patient needs physical therapy, that patient needs rehab of some sort, that patient may need surgery. It's a variety of reasons that go along with that. So one of the things that we talk about is what we call continuum of care. Now, continuum of care is based on several different levels of care: primary, secondary, tertiary, and quaternary. And we're going to talk briefly about each one of those in a little bit. How is healthcare organization structured? Okay, if you remember from previous classes, especially Intro to Healthcare Services, and you would have learned in that class how different organizations are organized based on facility. Every facility is going to always start with a governing board. These are your stakeholders, your trustees. You're gonna every institution is going to have an administration staff. These are the individuals that are responsible for the decisions that are made in and around the facility. After the administration staff, then you have your medical staff. That's your physician, nurses, your technicians, and etc. Then it goes on to hospital departments, services, and committees. And then you have what you call successful meetings. If you remember from previous classes, we talked about different types of facility ownerships as far as for-profit and not-for-profit. So just to give you a general overview, as Chapter 11 is designed to do, I listed in the slides some other places that are examples of continuum of health services. And again, keep in mind, we're talking about primary, secondary, tertiary services. One of the first type is convalescent care. Convalescent care is basically care that is given to take care of elderly individuals based on the needs that they have. Convalescent care doesn't just care for individuals that are older and able to take care of themselves, but they also take care of the physically ill or injured individuals who require convalescent care in order to recover from the things that they're experiencing. So just to give you some examples, nursing homes and long-term care. So with nursing home and long-term care, those individuals, most of those individuals, shall I say, are usually there for a significant amount of time. You may have a few that are there for a temporary moment. You may have some that are only need somebody to watch them, until the children are off work or something of that nature. But when we talk about convalescent care, we can't talk about convalescent care without talking about how those individuals may have ended up in those different places. And usually it's because, next slide, they have gone through some type of ambulatory care or they're coming from a clinic. So ambulatory care are places where several physicians with different type of specialties come together, combine their practices, and help to deliver the best possible care they can to their patients. So when I mention the word specialties, what am I referring to? Well, that's pretty much any individual that is in a particular study or a professional line of work, such as in the notes, pediatrics. And we know pediatrics are the individuals that deal with the healthcare needs of children. You have orthopedics, and then you have obstetrics. And of course, those are the pregnant moms to be. Okay, our next example of continuum of health services is physician and dental facilities. And of course, those are pretty obvious as to what they offer. And basically with physicians, they help to promote wellness and diagnosis of illness. They help to provide treatment for anything that you need treatment for. That's pretty much what they're here for. Okay, then with our dental facilities, of course, we know exactly what our dental facilities are for. Those are the individuals that help to keep, take care of our pretty white teeth. Sometimes in dental facilities, a little minor surgery may have to be performed. So, just kind of keep that in mind when you're thinking about dental facilities. It's not all about just cleaning teeth and taking x-rays. Sometimes it goes a little bit more extensive than that. And again, that too depends on the patient's needs. Then you have your rehabilitation centers. So your rehabilitation centers, individuals who have been sick or injured due to some sort of disability, and they need some recovery from that illness or injury, they did go to a rehab center. Senior daycare. Senior daycare is designed to take care of your senior citizens during the day while their family members are working or unable to take care of them or have some things they need to do, and mom and dad have to be watched 24 hours. So, why not just take them to an adult daycare or a senior daycare? They can do a variety of things. It's a place where, they're cared for on a day-to-day basis. They have activities that they do. They can go through a little rehab while they're there. They're given their medications. They're being assisted in their mobility and their way of getting around. Prenatal care. Prenatal care is the care that is given to moms who are, pregnant with children. It's not, and the one thing about prenatal care is not just there to take care of the mom, but it's there to take care of the mom and the baby at the same time. With the advanced technology that we have now, a lot of maternal and infant death rates have been reduced because now there are so many different types of specialized testing that can be done for genetics and things of that nature, just to make sure babies are okay, they don't have any deformity, and if so, with the technology that we have, you can catch those deformities pretty early on. Health promotion, when we talk about health promotion, basically we're talking about ways in which we can promote good health. You know, what can we do to make life better, make it a little bit more of a healthier lifestyle, incorporating wellness, exercise, and more education within the health arena. When we look at health promotion, there are some focus areas as it pertains to health promotion. One of those things is maintaining physical activity and fitness. It's better for you to be active and moving about than to be sedentary. Usually when you're sedentary, it takes you longer to probably, or shall I say, digest food, get around as often as you would like to. So maintaining physical activity and fitness is one of the top main ways toward health promotion. And one of the other things toward health promotion, in conjunction with the physical activity and fitness, is managing your body weight. And in managing your body weight, third bullet says you got to maintain proper nutrition. Okay, so in maintaining proper nutrition, it involves eliminating tobacco use and the controlled useness of alcohol and other drugs. So health promotion focuses on 3 factors. One being violent and abusive behavior. The next one is educational and community-based health programs. And the third one is the focus on mental health and mental illness. So what is health protection? Health protection is pretty much protection for citizens in a particular state or particular area. So when we talk about health protection, one of the things we want to think about is, what is health protection? How does it apply to us? Well, it's basically the preservation of a safe and healthy environment. Meaning that the health department, as we've already discussed, in previous classes, they're the forerunners or the front line to making sure that in the event, something happens to like the water that we're drinking, if there's something airborne going on, their job is to make sure they get that communication out to the citizens so that they can be made more aware. Now, to kind of talk a little bit about the 3 different levels of primary disease prevention. The 3 different levels of disease prevention. So the first one being primary. So basically, primary is like your point of contact with the physician. This is where you have genetic testing, counseling, and health screenings take place. This is this particular level is where if you have questions or concerns about something, you're not sure about something don't feel right, something don't look right, it's at the primary stage where all of those things are discussed. Why? Because, next slide, we get into the secondary disease prevention. That's pretty much where something has been detected, now it needs to be treated. So that can include things like, high blood pressure, high cholesterol screens, your pap smears, mammograms, for men, prostate screenings. Any of those type of things are classified as secondary disease prevention. Then you have your tertiary, okay, that's your third level. Basically, You've gone through the primary visit with the doctor. You know what your diagnosis is. Now you have to fix that diagnosis or improve that diagnosis or make that diagnosis a little bit better. You do that by way of the tertiary disease prevention stage. Now, the quaternary disease prevention is pretty much an extension of tertiary. Now, and one thing I want to mention about tertiary is also that department that deals with the therapy side of patient, physical therapy, occupational therapy, things of that nature. Services are delivered by the patient, the provider, the payer of the insurance company, okay, so in the delivery of services, be it patient or provider or payer or political government, regardless of who delivers the services, those services have to be taken care of, okay? So no, services are not free for patients, okay? Patients have to pay for those services. If that patient is not the provider, then whomever is the provider or the policyholder of that particular insurance, that individual is responsible for payment of those services, okay? Now, going into chapter 12 really quickly, health promotion and disease prevention. So why is it important? Why do we have to stress health promotion and disease prevention? Well, one reason is because the main goal is to protect, maintain, and restore health of individuals. Now, you got to keep in mind, when we get to that point where we learn to take care of ourselves or take better care of ourselves, we will see the decrease in the need for having to go to the doctor. We will see that. Health promotion is basically promoting good, healthy lifestyles. Now, a healthy lifestyle starts with the individual. It doesn't start with the health department. It doesn't start with wellness centers. It doesn't start with any of that. It starts with the person and the lifestyle that he or she is living. Okay? You consume certain foods that you know have, high numbers of this or high numbers of that, and yet you consume it on a day-to-day basis. It's all, again, it's about your lifestyle. That smoking cigarettes is bad for you, but it's about your lifestyle. The drinking, alcohol is bad for you, but again, it's your lifestyle. When the person changed the lifestyle, everything else changes. The lifestyle has to be changed first. That's where the Health People 2010 come into play at. What is its objectives? They have a slew of objectives. And when I gave you the activity about Healthy People 2010, I gave you that so that you can see the inside, the detail. So you can see the detailed picture of really what Healthy People 2010 is all about. So they deal with certain topics such as nutrition and overweight, tobacco use, obesity, physical activity, mental health and mental health disorders, family planning. All of those things are covered under Healthy People 2010. Health protection, OSHA is one of the companies that really work hard to protect citizens, to make sure that when we go to the doctor, we're being provided a safe environment, making sure that when we're working in a place that feeds patients and stuff, that the food that we're handling is being handled properly. So OSHA pretty much fights for us as the patient. How do you prevent disease? One way is through wellness. Okay, that's wellness. One way is through wellness, and that's through using preventative measures that pretty much produces good health habits. Wellness centers are great to have. They help to provide information, education, training to help individuals live a much healthier lifestyle. So in summary of chapter 12, and it just kind of recap what I said before, patients, providers, payers, politicians, whomever it is, all of them are advocates for the healthcare system. So they have, they have the ability to learn about health promotion. They have the ability to learn about wellness. Patients, providers, payers, politicians, they can serve as advocates. Okay? Because it's all about producing that healthy environment, safety environment. Now in chapter 13 talks exclusively only about primary care. And again, keep in mind, if you haven't already written it down, primary care is the first point of contact with the physician. Okay, so basically, a primary disease prevention level is usually initiated by a visit to the physician's office, meaning that an illness or a disease or something of that nature brought you to the office in the beginning. So at that moment, this is like your entry point into the health services system. So, when we look at primary care and the main goal of primary care, we have to think about how can we decrease the risk of illness in individuals. And that's what primary care is all about. Primary care is about decreasing illness in individuals. If you can catch things in the primary disease stage, you can usually prevent anything secondary or tertiary. So who are some of the primary care providers? I have that slide listed for you in the notes. So I won't read those off the slide. You can see those and read those off the slide. What are some primary care services? Those are examples of things like physical exams, and those should be done at least yearly. You have diet moderations, you have vaccinations. Those should start when you're a child growing up, making sure you're getting your vaccinations like as often as you're supposed to. Exercise programs is a good example of primary care services, as well as patient education. Accessing primary care will always be a barrier for us, and that barrier will always be finance. Okay, as jobs become lesser and less plentiful, individuals are struggling with making sure they have access to health care, especially those that do not have insurance. So what does the future look like for primary care? Well, primary care is the backbone health services system. Why? Because remember, that's the first point of contact. That is what generates a lifelong relationship with the physician. And that's very, very important. That's very, very needed. Primary care is primary care sometimes can be kind of up and down. especially when you start having providers who are not satisfied with their job. So when I say providers, of course, you know I'm talking about physicians, nurses, technicians. Anytime those individuals become unsatisfied with their job, they usually don't stay in the current position that they are in. So, you know, that could pose a problem in later years